The streets of London have gone quiet again. British Prime Minister Boris Johnson put the nation under lockdown after a new variant of the coronavirus emerged.
It's clear that we need to do more together to bring this new variant under control.
In South Africa, another strain has doctors worried, says University of KwaZulu-Natal epidemiologist Tulio de Oliveira.
It has been dominating almost every infection that we have in the coastal area. This is from Eastern Cape all the way to Cape Town.
The UK strain has spread to at least 39 other countries. The South African variant has turned up in another 9. Both seem to be driving their countries' surges in infections. But scientists cannot say for sure yet, says Johns Hopkins University immunologist Andrew Pekash.
That really needs to be investigated in other countries to see, is this just something that happened in England for a confluence of other reasons? Or is this something that is really specifically associated with this virus? And if it is, then we should be seeing that in other countries.
Okay.
The variants do not appear to make people any sicker, but the increase in cases will likely mean more hospitalizations and more deaths, Pekash says.
If you simply have a virus that can infect more people, then the total number of people go up and all of those other parameters go up as well, too.
Nice and relaxed.
The new mutated viruses have appeared just as vaccines to fight the pandemic begin to arrive. But the vaccines should still work, says the British government's chief scientific advisor, Patrick Vallance.
When a vaccine is given, you don't just make one antibody against one bit. You make lots of antibodies against lots of different bits. And so it's unlikely that all of that would be escaped by any mutation.
Tests are underway to make sure. Viruses mutate all the time, and the vaccines eventually will need to be updated. But that's easier than ever, Pekash says.
Particularly these mRNA vaccines have the potential to really quickly be updated to whatever is circulating.
Both the Pfizer-BioNTech and Moderna vaccines are this type. If the new strains take over, these vaccines may allow for quick adaptation to an ever-changing virus. Steve Baragona, VOA News.